Hi, Jack Cush here from RheumNow with another QD Clinic. QD Clinic is brought to you by RheumNow.live 2024 in Dallas in late January. Be there, register at RheumNow.live. Usually QD clinics are lessons from the clinic. Common cases, common problems, which require kind of thought and a plan. I got an odd case, and I'm going to present it, and I think I'm backed up by the literature. This is a case of lupus and psoriatic arthritis. Yes, together. What? 23-year-old gal diagnosed with lupus 2 years ago. Lupus based on polyarthritis, mainly PIPs in knees and a few other joints. Very strongly positive ANA, very strongly positive double-stranded DNA, normal complement levels, no proteinuria, very high CRP, 4.5 milligrams per deciliter. That's like 45 milligrams per liter. Alopecia, 30 pounds of weight loss, lymphopenia, and rainouts. She's got a lot of arthritis and arthritis-related symptoms. But not at the first visit, because she was seen by someone else at the first visit, but I saw her the last 3 or 4 visits and found really impressive scalp and behind the ear plaque psoriasis, confirmed by a dermatologist. She's got nail pitting. She doesn't have any truncal facial intertriginous plaque psoriasis. And so the story is, what's the deal? She's been managed with as if she has just lupus until recently. And that means she was given hydroxychloroquine and then prednisone and then azathioprine. So much so that she's on like 5 milligrams per kilogram of hydroxychloroquine, averaging 300 milligrams a day. She's on 100 of azathioprine. She's taken 5 of prednisone. She takes some Tylenol. She still has swollen joints. She still has very active psoriasis. She's taking topical things for her psoriasis. The question is, can this happen? Why would this happen? I've taken care of 2,000 lupus patients in my lifetime, and God knows way more psoriatic arthritis, and I can't say I've ever had this combination before. But if you look in the literature, it exists. And, the rationale for it existing is a little surprising to me. One mistake would be to say, if you look at a cohort of PsA patients, will you find any lupus? And the answer is yes, because if you're using TNF inhibitors to treat the psoriasis or psoriatic arthritis, you'll get some drug-induced lupus, as we talked about earlier this week, from the TNF inhibitor. But if you look at the opposite way, you do find a higher incidence of psoriasis. So it looks like there could be as much as a 2-fold increased risk of getting lupus. And the numbers are really, really low. I mean, in this population-based study from 2021, there was 0.37% of the PsA patients had lupus, and the control patient was 0.15, so a 2-fold higher risk. If you were going to have lupus without PsA, you were going to have many more autoantibodies than the ones associated. Older age may be associated with this presence, and I don't rely on this. This lady is really young, right? 23. So, what about mechanistically? Well, if you look at a lot of the newer literature on the pathogenesis of lupus, there's a lot of talk about new roles for T cells and Th17 cells and IL-17 and possibly IL-23 or 12-23, and that these should be new targets therapeutically to manage lupus. So I have scratched my head a few times, but since I'm not getting anywhere with 2 visits, trying to rely on heavy treatment and I can't say I'm using heavy treatment, but what I think is effective treatment for lupus, now I'm going to go out and start targeting psoriatic arthritis. I'm not using IL-17 inhibitors as yet. I'm going to go with my JAK inhibitors as my first choice, and with the idea that I can possibly get her off steroids, lower the hydroxychloroquine, get her off azathioprine, and see what that does. An interesting case, is it not? An interesting meeting is RheumNow Live. I want to let you know that what's distinctive about RheumNow Live is many things, including these TED Talks we do. You know, we're famous for doing them. Nobody does them. These are 15-minute talks. And this year we've got like 7 or 8 of them. And that includes, we want them to be in a TED-like format. They can be mini lectures. They can be inspirational kind of things, thought-provoking. Immunosenescence from Connie Way and The Future of Gout from Lisa Stamp. Preclinical lupus, David Karp. Myths and mistakes from the medical literature, Mike Putman. Serologic myositis testing from Lisa Christopher Stein. Ethics in Rheumatology, Artie Kavanaugh, Jack Cush on The Extraordinary Rheumatologist. I think these are really spicy, really interesting, really informative things that you'll find at RheumNow Live. You won't find anywhere else. We'll see you in Dallas on January 27th and 28th.